Hi guys, welcome back to the channel. This is episode number 11 and the topic today is proactive patients versus reactive patients. So how would I define a proactive patient? Right, a proactive patient is a patient who proactively takes a role in their healthcare. They're generally someone who goes to the gym, does some exercise, does some swimming, generally looks after their diet. Someone basically who has an instinct to just look after themselves and to practice that. A reactive patient is basically the opposite. It's someone who doesn't do any exercise, who makes poor lifestyle choices, and who, well, I don't know if they don't have the instinct to look after themselves, because I assume that we're all born with that instinct to look after ourselves. So perhaps either they're just not born with that instinct, which is sad, I suppose. Or if we are all born with an instinct to look after ourselves and to preserve life, then why are they indulging in kind of a self-destructive lifestyle? But anyway, that's a point of philosophy that I guess is for another day. So the reason I'm doing this video is because I wanted to get this conversation out there, because it's a conversation that I have pretty much every single week in the clinic. I love a proactive patient, because a proactive patient will come to me seeking my services to try and enhance their spinal health, I suppose. A reactive person will do the same thing. They will come to me looking for me to enhance their spinal health. The fundamental difference is that the proactive patient will probably keep up their care, whereas a reactive patient will generally go away when the pain's gone and phone me when the pain's back again. Now, if you're judging your spinal health on pain levels, then you're literally judging your spinal health on the worst possible outcome measure. And the reason for this is that mechanical problems exist in layers. So what do I mean by this? This is a really important principle. The muscular system has got a lot of elasticity. There are scores and scores of joints in the body, all formed by bones that are joined together by ligaments. Ligaments have got elastic properties as well. So there is a lot of elasticity within the musculoskeletal system, and this elasticity means that there is a lot of ability for the biomechanical system to compensate for imbalances at the outset. So, to give you an example, let's talk about lower back pain. The day that you get lower back pain is not the day that your lower back decides to not play ball. The day that you get lower back pain is the day that has followed probably months and months of dysfunction that has built up silently, leading to that problem. So if I can give you a specific example, let's talk about lower back pain. Now, for me as a chiropractor who is not interested in symptom-led care, but more interested in trying to get the most out of your function to allow you to live an optimal life for your set of circumstances, I need to go through layers to try and get to the root of your lower back pain. So let's say your lower back has jammed up and you got lower back pain. That's more than likely happened because the muscles around the lower back have tightened. Now, there are lots and lots of reasons why the lower back muscles will tighten, but just to go down one specific explanation, the lower back muscles have tightened because the buttock muscles have maybe switched off. Now, what's the most likely reason why the buttock muscles have switched off? Again, there's a few, but the most common one would be the hip joint or hip joints have maybe stiffened a little bit. Don't forget, in previous episode, we spoke about the feedback loop between the joint, the brain and the muscle. So if the joint stiffens or misaligns, it tells the brain this information, and then the brain sends a message down to the surrounding muscles to act accordingly. So some muscles may tighten, some muscles may switch off, but in essence, muscle imbalance is created by the joint dysfunction itself. So just to work back up now in the other direction, we have an original hip problem that you knew nothing about. You certainly didn't feel that the glutes were switching off. You might have had the odd stiff day as the lower back muscles were tightening, but then all of a sudden, bang, the lower back goes, and that's your problem. So a patient will phone up, they'll come in, lower back pain, and I'll soon get an inkling as to whether a patient is a proactive patient or a reactive patient. The reactive patient will come in saying, usually, can you fix me? And I've stated to new patients in the past, loudly and bluntly and proudly, no, I can't fix you. I can assist you in fixing yourself. But I cannot take on the responsibility of fixing you, because ultimately this problem is probably down to lifestyle. So maybe if you work at a desk, if you suffer from postural strain, if you don't go to the gym, if you have poor posture, these are all external factors out of my control that have led to your problem. So no, I can't fix you, but I can help you to identify what the problems are that's contributing to your position that you're in now with lower back pain. The proactive patient will come in and they will be prepared to listen to what I have to say. A proactive patient will allow me to go through my physical examination and objectively work my way through these layers, and they will allow me with interest to explain the problem to them and explain my role. Not only in the short-term care, but they will probably be open-minded enough to allow me to suggest that I remain involved with maybe some maintenance sessions, just like a dentist remains involved in your oral health by checking your teeth once or twice a year. A proactive patient will be fundamentally interested in getting the most out of themselves, and they will be perfectly happy for me to maintain my role in the long term. A reactive patient, on the other hand, will usually come in, get fixed, and then walk. And those are the patients after 20 years in practice that I don't really want, if I'm honest. I have enough knowledge and enough experience to work alongside individuals to help them continuously age better, age well, and get the most out of their mobility, I guess, of their spinal health. I've got less interest in going to the trouble of figuring things out with someone who's then just going to go away, cancel their appointment for no reason, and then ultimately just come back when they're down a well again, and they want me to kind of pull them out of that hole, only for them to kind of walk away again and then come back, and we just repeat that process. I've got very little interest in being involved in a reactive patient's ongoing chaos. So yeah, I mean, it's no different than a dentist saying to you, come back when you need me. I would never say come back when you need me to one of my patients. I would say come back in X amount of weeks based on the objective information that I've gleaned from your physical examination today. I wouldn't say come back when you need me, because again, we're then relying on a patient-led treatment plan, a patient-led protocol that's purely based on subjective pain levels, which, remember, are the worst outcome measure to judge spinal health by. So yeah, that's it. That's the end of the conversation, I think. I hope I haven't missed anything. But I just wanted to get that out there, because this has probably been 10 minutes this video's been running, and I just don't have 10 minutes on every patient's slot to go through this. I do explain this at the start of every single new patient follow-up, but I guess it's just soon forgotten about. So yeah, I thought it was important to record this video so as people can be perhaps reminded occasionally of the importance of essentially letting the chiropractor make the decisions and letting the chiropractor be involved in your ongoing care. Assuming the chiropractor is a decent chiropractor, won't rip you off, and is doing this for the right reasons, which obviously I am. So thanks for listening, and on a lighter note, the next couple of videos we're going to go back to some exercise demos, so look out for them. All right, thanks guys.